How does Wegovy help you lose weight?
Almost half of teenagers receiving semaglutide have managed to lose sufficient weight.
Google searches for Ozempic have been skyrocketing.
So what happens when you stop taking Ozempic? Do you gain some of the weight back? Do you gain all of it back? Or do you not gain anything at all?
Semaglutide, marketed as Ozempic and Wegovy, has recently sparked significant public interest. This attention largely arises from its non-prescribed use for weight loss, prominently promoted by social media influencers and celebrities like Elon Musk, Amy Schumer, and Oprah Winfrey through dramatic before and after photos. This trend has led to a surge in the drug's use by individuals not diagnosed with diabetes, specifically for slimming down, a departure from its intended medical purpose. This shift has not only led to a shortage of the medication, affecting those who require it for managing diabetes, but it has also raised concerns. The growing popularity of semaglutide as an easy weight loss solution is worrying health professionals about the rise of eating disorders and the unhealthy obsession with body image for aesthetic rather than health reasons. What is semaglutide? The main ingredient in Ozempic, called semaglutide, works by mimicking a natural hormone in your body called GLP-1. This hormone helps your body release insulin to control blood sugar after you eat and prevents another hormone called glucagon from raising your blood sugar too much. Ozempic is a medication approved by the FDA for adults with type 2 diabetes. It helps control blood sugar levels and reduces the risk of heart problems like heart attacks or strokes in people with diabetes and heart disease. Ozempic lowers blood sugar by 1. Helping your pancreas produce more insulin when your blood sugar is high. 2. It prevents your liver from making and releasing too much sugar. 3. It slows down food, leaving your stomach. By a similar mechanism, Ozempic causes weight loss as a side effect. But take note, it is not FDA approved for weight management treatment. So what happens when you take it and you do not have diabetes? Following administration, semaglutide boosts insulin secretion and decreases blood glucose levels. Consequently, it slows down gastric emptying, diminishes hunger, and induces a sensation of fullness. The weight loss effects of Ozempic can be attributed to two main factors. 1. Slowing down stomach emptying. Ozempic delays the speed at which your stomach empties after meals, which in turn slows down digestion, prolonging the feeling of fullness and reducing the urge to eat. 2. Mimicking the hormone, GLP-1. Ozempic mimics the action of GLP-1, a natural hormone in the body that enhances feelings of satisfaction and fullness after eating, thereby reducing overall food intake, which can result in weight loss. While weight loss can be achieved through this type 2 diabetes treatment, there are abundant side effects you need to watch out for. Now let's talk about the side effects of Ozempic and Wegovy. Common adverse reactions to Ozempic include nausea, vomiting, diarrhea, abdominal pain, and constipation. Patients are advised to consult their doctor before discontinuing use, although the FDA recommends immediate cessation of semaglutide injections and seeking medical assistance if a severe allergic reaction occurs. Additionally, Ozempic may rarely lead to more serious side effects such as pancreatitis, vision changes, and severe allergic reactions. An identifiable indicator that an individual is using Ozempic is the phenomenon known as Ozempic face. This term refers to the typical side effects associated with semaglutide, which can result in facial skin sagging and aging. Healthcare professionals may suggest lifestyle adjustments or facial fillers to address these skin and facial side effects. Facial fat plays a crucial role in protecting facial aesthetics and elasticity. Weight loss can cause dermatological alterations and a reduction in size because the fat that supports and cushions the skin diminishes. Moreover, the skin loses its ability to retract after rapid weight loss due to decreased levels of elastin and collagen, essential for maintaining structural integrity. Individuals taking Ozempic may experience various facial symptoms, including increased signs of aging such as more lines and wrinkles, loss of fat leading to loose and sagging skin, a hollowed-out appearance, and lipodystrophy affecting fat accumulation and storage in the body. To mitigate facial side effects, individuals using Ozempic under a prescription may not have full control over prevention, but could discuss potential solutions with their doctor. These may include reducing the dosage, changing to a different medication, drinking 1 to 2 liters of water every day, improving protein intake with a protein-rich diet, using dermatological fillers, and lifestyle modifications to maintain a healthy weight. Discontinuing Ozempic can result in a clearance time of approximately 5 weeks for the drug to be completely eliminated from the individual system after the last dose. Let us now discuss the risks of semaglutide towards eating disorders. An often overlooked aspect of taking semaglutide medications like Ozempic is their potential impact on mental health. The popularity of weight loss drugs can skew perceptions of their benefits. Healthcare providers carefully evaluate patients for conditions such as anorexia anorexia nervosa before prescribing medications like Ozempic or Wegovy. They discuss realistic goals with her patients and emphasize the importance of lifestyle changes such as diet and exercise that are not related to medication. It is also worth noting the importance of considering food behaviors and the risk of disordered eating habits before using these medications. Caution must be taken as these medications might be overprescribed based solely on body mass index, which is not a perfect indicator of health. Furthermore, studies have shown that BMI is not always an accurate measure of metabolic health. Expectations about the mental health benefits of semaglutide medications can also contribute to negative outcomes. Some individuals may use these drugs hoping to feel happier and healthier, but such changes are not always realized. People might feel depressed and anxious if they pin their hopes on the medication as a life-changing solution, only to find that it does not alter their fundamental self or their relationships. Weight loss alone does not change everything. Discontinuing semaglutide, like stopping any medication, comes with side effects. Similarly, as with many weight loss solutions, individuals who cease taking Ozempic are likely to regain the weight they lost. Now let's dig deeper on what could happen when you stop taking it. 1. Your appetite will return. When people take Ozempic, they generally consume less food because semaglutide slows digestion, prolonging the time food stays in the stomach, which enhances feelings of fullness. Additionally, it affects the brain to reduce hunger and dampen the satisfaction derived from eating, according to the FDA. David Schaefer, MD, an attending plastic surgeon at Lenox Hill Hospital and Northwell Health in New York City, mentions that on semaglutide, he feels full after just a few bites, a sensation that diminishes if he misses a dose. However, this rapid feeling of fullness disappears once Ozempic is discontinued, leading to an increase in appetite back to pre-medication levels, as noted by Kushner, making it challenging to adhere to a lower-calorie diet. 2. You will regain weight. The cessation of Ozempic results in a return of hunger and food cravings, leading to likely weight gain. A 2022 study funded by Novo Nordisk, the manufacturer of Ozempic and Wegovy, found that individuals who stopped taking semaglutide after 68 weeks regained 2/3 of the weight they had lost. Whether Ozempic is used for treating obesity or type 2 diabetes, it should be part of a broader treatment strategy that includes healthy lifestyle changes such as a balanced diet and regular exercise. It's advised to continue these healthy lifestyle changes even after stopping the medication to maintain some of the health benefits related to body weight and blood sugar control. 3. Ozempic face will go away. Significant weight loss induced by Ozempic can lead to changes in skin and a reduction in facial fat, resulting in a gaunt, shrunken appearance known as Ozempic face. These changes can be addressed with injectable facial fillers by a board-certified dermatologist or plastic surgeon, suggests Joshua Zeichner, MD, an associate professor of dermatology at Mount Sinai Hospital in New York City. Stopping Ozempic will also reverse these facial changes, allowing the face to regain its previous fullness as body weight is regained. 4. Side effects will subside. Ozempic is associated with several common side effects, such as nausea, constipation, vomiting, heartburn, gas, headache, and dizziness. While not everyone experiences these side effects, and they may be mild for some, they can often be minimized by starting with a low dose and gradually increasing it, as recommended by Kushner. Dietary adjustments can also mitigate side effects. Once Ozempic is discontinued, those who experienced side effects and continued treatment will find that these side effects diminish. 5. Blood sugar climbs. For those with type 2 diabetes, using Ozempic for blood sugar management, stopping the medication may cause their blood sugar levels to rise to around pre-medication levels, states Beverly Chang, MD, an endocrinologist and assistant professor at Weill Cornell Medicine in New York City. Even if individuals maintain the eating habits developed while on Ozempic, blood sugar may increase when they stop the treatment, as the drug enhances insulin production, a key hormone in blood sugar regulation. Concerns have been raised about Ozempic shortages, particularly affecting those with type 2 diabetes who rely on the drug for blood sugar control, possibly exacerbated by its use for weight loss. However, alternative medications within the same class as semaglutide are available for those with diabetes, offering other options for treatment. Why you should not take it. Ozempic seems not to be a miracle drug as we encounter more side effects. This includes the emphasis on consulting your doctor. Aside from requiring a prescription before getting your hands on this medication, it is highly advised to take caution when attempting to use, as you may encounter risk of drug interactions for those taking Ozempic without medical supervision. There are serious side effects, including allergic reactions, hypoglycemia, increased thyroid cancer risk, gallstones, and swelling of the pancreas. And mostly using the drug for weight loss and stopping may also mean regaining weight when no longer taking taking the medication if lifestyle changes haven't been made. More than that, the off-label use is causing difficulties for care providers to perform essential tasks as they struggle to find Ozempic for their patients. The health of our patients living with diabetes who are unable to receive their prescribed medications, such as Ozempic, due to shortages. It is critical to use Ozempic responsibly and not perceive it as a mere magic weight loss solution. If you want to see more health, nutrition, and lifestyle tips, please subscribe to my channel and turn on notifications with the bell icon. Stay healthy and happy.